Hello everybody, I am Simon Mamatas and welcome to my channel. In today's video, I am going to demonstrate how to administer oral medication. So the oral route is the safest, most convenient, and less expensive, and the most commonly used route. So the purpose of this procedure is to prepare and administer oral medication safely and accurately so that the client may receive maximum therapeutic effectiveness from them. The first step in doing the procedure is to check the client's chart and verify the doctor's order to make sure that you are giving the right medication to the right client. And the physician order is the most reliable source and only legal record of drugs the client is to receive. Now I'm gonna look at the doctor's order and the medication administration record of the client and see what medication I'm going to administer today. Alright, the client is De La Cruz Juan, date of birth August 5, 2000, room number 300 and bed number is 1. Physician, Jans. He has an order for paracetamol biogesic 500 milligrams, 1 tablet every 4 hours as needed for fever, to be given orally at 6 in the morning. He has no known for allergies and the lab result shows that the kidney has no problem. Mr. De La Cruz doesn't have order for MPO and no difficulty in swallowing. And there is no also report on recent gastrointestinal surgery. So, assessing for contraindications of oral medication with a client is important because alteration in GI function interfere with medication distribution, absorption, and excretion. So, patients with GI sanction do not receive benefit from oral medications because they are sanctioned from the GI tract before they can absorb. Paracetamol is a combination of acetaminophen and antihistamine. So the acetaminophen helps to reduce the fever and mild to moderate pain like backache and headache. The common side effects of this drug are drowsiness, flushing, and minor stomach disturbances. Next step, arrange the tickets in order in the medication tray. Now I'm going to medication cart with the medicine ticket to gather my supplies and medications. Next step, do the hand washing or you can use an alcohol to control the spreading of microorganisms. Brings prerequisites to preparation area to save time and efforts. Now I'm going to perform my first check. This is the client's medication box. Take medicine ticket one at a time. So the right client is De La Cruz, 1. Right drug, paracetamol biogesic. Right dosage, 500, 1 tab every 4 hours. Paracetamol biogesic, 500 milligrams. To be given orally at 6 p.m. The expiration date is August 2025. Reading the label and comparing it against the medicine ticket will reduce the error. Next step, compare the name of drug on label with the name of drug on medicine ticket. So, they are the same. This step ensures the safety of the client and to make sure that the client is receiving the right drug. Pours or prepares prescribed dosage of medicine in glass in liquid or suspension form. So first step, shakes bottle if necessary. Mixing liquid suspensions just before pouring ensures that correct amount of medication, not just the solvent, is measured for the right dose. Removes cap and places it upside down on the counter. This prevents contamination of inside of the cup. Holds medicine glass at eye level to allow more accurate measurement of small amounts. So I'm going to pour 10 ml. Place thumb on prescribed level and rinse it at the lower meniscus to prevent spilled liquid from dripping and swelling level. Pours the exact amount of medicine prescribed into the medicine glass. This ensures accuracy of measurements. So I'm going to pour 10 ml. Wipes rim of bottle with tissue paper and replaces cup. This prevents contamination of contents of bottle and prevents bottle cap from sticking. If the drug, like tablets or capsule, is in a bottle, gently shakes the prescribed amount into the bottle cover, like this. So this drug is a capsule one. So I have one capsule in the bottle cover. If in a box, shakes prescribed number into the medicine glass. This is the medicine ticket and this is the drug. Patient name, De La Cruz 1. Drug, paracetamol biogesic 500 mg. This is a paracetamol biogesic 500 mg. Dosage and frequency 1 tablet every 4 hours. Place each medicine in a separate container. Return stock containers or unused unit dose medication to the drawer. This will prompt the drawer containing the selected medication. Label medication cups and pour medication with the client's name before leaving the medication preparation area. Do not leave drugs unattended to avoid any fatal incidents. Always remember to keep the medicine ticket and the drug together at all times. This prevents the interchange of the drugs. Now I am going to do my second check. I'm going to compare the medicine to the MAR. So the client is De La Cruz 1. He has an order for paracetamol biogesic 500 mg 1 tablet every 4 hours as needed for fever to be given orally at 6 a.m. So the medicine and the MAR are the same. Presents the prepared medication and medication booklet to the CI for checking and to confirm that I did or prepared the right medication, right dosage for the right client. Hello ma'am, good morning. Kindly check my prepared medication for Mr. De La Cruz from room number 300. Transport the medicine to the client's bedside carefully and keep inside the medicine tray at all times. This ensures the client's safety. Hello sir, good morning. How are you today? It's me, Saima Mamatas, your nurse for today. I am here to give your medication. Sir, can you tell me your name and date of birth? Thank you. Alright, now I'm going to assess you to set down so you can swallow properly. Your medication is given orally and I don't want you to choke. Okay, are you feeling good? Sir, do you have any allergies? You? If the client says no, then we are ready to give the medication. But if the client says yes, then we have to hold the medication and report to the physician. Sir, I have your medicine here. It's paracetamol biogesic 500 mg. This is your doctor's order to reduce your fever. Do you want to take this now, sir? As you can see, the tablet is still in its wrapper because I want the patient to see what medicine I am giving so I can gain his trust, because sometimes the client got the medicine and refused to take it. So here it is. Okay. Stays at the bedside until the client has taken its medicine, because sometimes the client just throw away their medicine and then return the client to its comfortable position. Okay, sir, I'm going to help you to lay down. Do you feel good now? Okay, thank you. Turns the medicine ticket to show that medicine has given to the client. After doing the procedure, clean the used materials and return to its proper places. Administering the oral medication, document the drug, type, dosage, patient, reaction, and significant symptoms related to the drugs. Documentation will serve as an evidence that you have done administering the oral medication to the right client. Then, signature. And that's all for today. I hope you enjoyed watching.